arthroplasty is a procedure done due to rheumatoid arthritis, osteoarthritis, or a severe fracture of the humerus, radius, or ulna. These conditions can cause pain, stiffness, or loss of ability to use the elbow joint during normal activities of daily living. This procedure requires the implant of metal and plastic hinges and stems for the damaged bones in the joint. This home exercise program will cover some of the goals and precautions associated with the total elbow replacement. My patient is 24-year-old Nashin Mania, who suffered a right distal humeral fracture. He is in his 8th week post-op and is ready to begin functional activities. Okay, Mr. Mania, we're going to assess your range of motion. Okay, if I could have you bring your arm down as close as you can to the table.
Right.
Okay. Okay, you are about at 45 degrees of active extension. I'm going to add a little pressure. Okay, and you're about at 39 degrees passive extension. Okay, now if I could have you bring your arm as close as you can to your body. Alrighty, there. Okay, you are about at 90 degrees of active flexion. Push it a little more. Okay, and you're about at 94 degrees of passive flexion. What we're going to do now is go over some of the general precautions you need to know about before we start doing exercises with your right elbow. But before we do that, I need to know how you learn best, or how you take things in the best.
I like to see it demonstrated first, and then maybe if I can have something written down that I can go home and read, I think that'll be...
Okay, great. Well, what we'll do after we go over precautions, we'll send you home with a copy of them written down so that you can learn them then.
All right.
So what we're going to do now is go over your precautions. And so what I want you to do is repeat them back to me when I say them to you. So the first one you need to be aware of is that you cannot lift anything heavier than 5 pounds with your right arm. So what's the first precaution?
That I cannot lift anything over 5 pounds with my right arm.
Okay, great. The second precaution you need to be aware about is that you cannot combine motions of straightening your arm and twisting your arm out. So what's the second precaution?
That I cannot combine motions of straightening my arm and twisting my arm out.
Okay, great. The third precaution is that you cannot put weight through your right arm or push or pull anything heavy with your right arm. So what is the third precaution?
That I cannot put weight on my right arm or push or pull on my right arm.
Awesome. So do you think you can tell me the 3 precautions that you need to be aware of?
I cannot lift anything more than 5 pounds. I cannot straighten my arm and turn out. And I cannot push, put weight, or pull on my right arm.
Awesome. Okay, Nash, do you have any questions about your precautions?
Oh, no, I think I'm pretty good on them.
Okay, great. So the first exercise I'm going to teach you is a stretching exercise for your elbow. So what we're going to do is have you grab the table with your hand, and you're going to wedge your elbow in between your upper body and your leg. And what you do in this exercise is you stand up slowly, and you use your body to lean into your elbow. This will help straighten your elbow.
Okay.
And you want to do it really slowly, and then sit back down. And what you want to do is hold it for 15 seconds, and we're going to try to do this 3 times a day for the next 5 weeks.
Okay.
Okay? So do you want to try that one?
So you want me to grasp the table,
Yes.
wedge my elbow between my torso and my leg,
Yes.
slowly stand up, and then just lean into my elbow.
Yes.
Is that correct?
Yes, it is. And how often are you going to do this?
I'm going to hold the stretch for 15 seconds.
Yes.
I'm going to do it twice a day and for the next 5 weeks.
Okay, we're going to do the stretch 3 times a day.
3 times a day.
For the next 5 weeks. Okay.
So, hold it for 15 seconds.
Yes.
Do it 3 times a day for the next 5 weeks.
Yes, sir. Okay, Nash, so the second exercise I'm going to teach you is a strengthening exercise for your elbow. So what we're going to do here is you're going to find a table at home that you can sit underneath, and you're going to place your right arm underneath it. And what you're going to do is try to bring your wrist to your shoulder. So you're going to press into the table trying to bring your wrist into your shoulder.
Okay.
And what we're going to do here is we're going to do 3 sets of 8 to 12 reps, holding each rep for 3 seconds. And we're going to do these for the next 5 weeks, 3 times a week.
Okay.
So, can you demonstrate?
So, you want me to put my hand underneath the table and try to lift the table up, just contracting my arm?
Yes.
Was that correct?
Yes.
Okay.
And how many reps are you going to do?
I'm going to do 3 reps, 3 times a week, holding it for 8 to 12 seconds.
Okay, we're going to do 8 to 12 reps. 3 sets. 3 sets of 8 to 12 reps.
Okay.
Holding each rep for
3 seconds.
Okay. And we're going to do these how many times a week?
3 times a week.
For how many weeks?
5 weeks.
Okay. So, what do you want to call this exercise?
Well, since I'm trying to lift the table up, I'm going to call it the not-so-quite table lift.
Okay. So, can you tell me how often you're going to do the not-so-quite table lift?
I'm going to do it 3 times a week.
Okay. And how many sets?
3 sets.
How many reps?
8 to 12.
For how many weeks?
For 5 weeks.
Awesome. Any questions?
No, sir.
Okay, Nash, the third exercise I'm going to teach you is a strengthening exercise for your elbow. So what we're going to do is try to find an object like a water bottle or anything that's weighted on both ends around your house and sit it at a table. What we're going to do is take it in your hand, and you're going to hang your hand off the table, and what you're going to do is to slowly open your palm up towards the ceiling and then slowly close it and point it down towards the ground.
Right.
Got it? Okay, and what we're going to do here is we're going to do 3 sets of this, 8 to 12 reps, and we're going to do this 2 times a week for the next 5 weeks.
Got it.
Got it?
Got it.
Can you demonstrate how to do it?
I think so.
Right.
Alright, so just grab the water bottle, take my wrist over the table, and just slowly go one way, and then slowly come back the other way.
Got it.
And when you say 8 to 12, do you mean 8 to 12 total or each way?
You want to do 8 to 12 reps, both sides.
Okay.
Got it?
Gotcha.
Okay, and is there a name you want to give to this exercise to help you remember it?
Since it looks like I'm pouring the water out, I guess I'll just call it the pour out exercise.
Okay, well, so for the pour out exercise, can you tell me how many times you're going to be doing this?
I'm going to do it twice a week for the next 5 weeks.
Okay.
And then I'm going to do 3 sets, 8 to 12 reps.
Good job. Do you have any questions?
No, sir.
All righty.